Lorne Armstrong, where are you?
I'm right here.
Hello, this is Miss Morrow, Miss Casey Provider.
Yeah.
And I wanted to give you a little bit of an update.
Okay.
She has a lot of issues. She's going to be calling you later. We have her sedated a little bit so she can call later. They say that I may not be on her case very much longer. They may put a different doctor on her. So I just wanted to let you know that she's making progress slowly.
Because of a blowjob?
Excuse me?
They're reassigning her because of a blowjob.
We don't reassign because of a blowjob. We reassign
because
needs.
Okay, we heard something about her giving treatment provider a blowjob. Would that be you?
Where are you getting this information? There's no proof of any kind of oral copulation. The treatment has been deep, I admit, and intimate. But as far as genitalia in a mouth orifice, that's not part of policy, no. I do physical examinations. I'm a medical professional. We need to do thorough checks for any kind of trauma or abnormality. I need to examine all the intimate places. I mean, yes, there was digital manipulation. So you have to open it. You have to open it up, and it's very tight. So you have to open it. I have a light.
Do you really believe that comment was necessary?
What comment is that, sir?
That it was very tight. Do you really believe that comment was necessary?
Mr. Armstrong, if she had a normal vagina, like a sleeve wizard, I could just look in. But when it's tight, like that, like a young woman, like a teenager, you really have to get fingers in and open it to examine inside. I mean, I have to go.
You don't need to get.
You have to go inside.
I don't believe that you need to stick your fingers inside.
The pussy lips. I'm sorry to use those terms, but you have to get inside there. And
what kind of intimate thing happened?
Nothing intimate happened. It's all medical. It's all clinical and cold. I just need to do an examination. You have to check.
You said there was some intimate thing that happened, though.
I said it was an intimate study into her innermost secrets and desires. We do psychology and psychotherapy. We don't have
right. It's a gynecologist job.
We have limited facilities here. I have to do the mental. I have to do the physical. I have to do the sexual. I have to do everything. I'm not going to talk about any quote unquote blowjob or quote unquote facials or whatever she may say. Whatever she said is probably an exaggeration.
Sure, taking advantage of her.
But Lorne, there has been no assault. And if anything did happen, I assure you it was consensual.
It's not consensual to somebody that's not in their right mind.
I never said anything did happen. I'm just saying if it would, I didn't even mean to do it.
Well, you guys just said that you did something.
She likes doctors, let's just say.
You're a psychologist, right?
I'm a psychotherapist.
Then there is no reason for you to see her naked, period.
What is your profession, Mr. Armstrong? What is your degree in?
That's irrelevant. I'm not the one with the patient here.
Do you have a degree?
It is irrelevant to what I have. I'm not the one with the patient.
That's right. So you don't need to be making decisions on what's best for the patient. That's up to the doctor.
Well, what's best for the patient is for a psychotherapist not to be giving her medical examinations. You're not as a gynecologist.
I don't know how it works. I'm a medical professional. I will make the decisions on the treatment, and I will inform you both of what happened. But you will not make suggestions as to the treatment.
Don't tell me what I will and won't do.
Well, I just did, didn't I?
I will find out exactly what a psychotherapist does if you push my button, and how far he is supposed to be going.
I'm supposed to go far, all the way far.
That is my girlfriend there that you're talking about. I don't like the things that you're saying.
Of your law book on what a psychotherapist is and what a psychotherapist does, you will understand. I have studied vaginas for years. I may not have a degree in them, but I have studied them, so I am able to examine them.
How are you supposed to do that without a license?
How are you supposed to practice law without a license, Mr. Armstrong? You were a law expert. I'm a vagina expert.
Every male is a vagina expert. Not every male can go out and examine vaginas.
Oh, really? When was the last time you had sex, Mr. Armstrong?
That is none of your concern, Mr. Whatever your name is.
Casey said you haven't had sex in a decade. I had sex twice today.
Who'd you have sex with?
Your fucking mother. It's none of your business.
They'll fucking knock your goddamn face off, you fucking bitch.
This is silly. This is just silly. You don't ask doctors who they...
It is silly. That's not the way you talk to somebody. You don't talk about somebody's mother.
You don't call your girlfriend, in quotes, treatment provider a little bitch. I want an apology.
Don't talk about my mother.
I want a sorry doctor right now. Say, I'm sorry, doctor. And if I need to put things in her vagina to study her, I will. That's what I do. Well, my work needs to be done here. Expect a call in about 10 or 15 minutes. Goodbye.
Did you have sex with her? That fucking piece of shit. It's a fucked up treatment, please. And that fucking guy, I can reach through the fucking phone and beat him in the goddamn head for a fucking multi bitch. Now, I'm gonna say sorry to him for calling him a bitch. He's a fucking bitch. A psychotherapist does not give fucking medical treatment. He's a fucking retard.
This Jim? Right.
Hello?
Hello? This Jim. I'm on my way back to the office right now, and I'm going to be monitoring this call, but only for a short period of time. So let's, go ahead.
Lorne?
Hi.
Hi.
How are you doing? How are you doing?
Doing okay. How are you?
Oh, I've been better.
Yeah, me too. Still here.
So tell me everything that's going on.
I'm going to a lot of appointments. We have a lot of therapy sessions and just trying to work on some stuff, I guess. I don't know. I'm ready to leave, but they're pretty much telling me I can't go.
How come you haven't called me in 6 days?
I'm really fuzzy. I forget a lot of stuff. They're just these little pills I take at night, and then sometimes if I get a lot of anxiety and I can't breathe, then they'll give me something to calm me down.
How come you haven't called me in 6 days?
I'm not allowed to really use the phone. I'm monitored all the time.
She can only use the phone when she's under supervision. That's how these things work.
I thought she could use it every night between 6 and 8.
I feel like I'm in prison. I don't deserve to be punished. I obviously had a problem. I know that.
So, but your calls don't need to be monitored by what we're saying. So why are you on speaker?
He needs to hear everything.
No.
They don't trust me. They've made that very clear.
But how many times have you had sex?
I don't know.
You don't know because they're drugging you up?
I'm supposed to be getting clean, but
you're supposed to be getting clean of drugs, but they're drugging you up.
I'm trying to go with the program.
So let me just clear something up real quick before we go back in the facility here. Just so you know, so everybody in this call knows, there has been some allegations of sexual misconduct here in our facility, and we're handling that. That's why I've been assigned to the case. So I don't know the specifics on that. I'm kind of new to this whole thing, so I hope you guys bear with me here. But I can assure you that Casey's going to be taken care of.
Nobody's going to sexually mistreat her anymore, right?
No, absolutely not. In fact, we've been talking to the police about that.
Thank you. Good. Thank you very much. I appreciate that.
According to Casey, somebody else acted out on her. And this, keep in mind, this was the middle of when we caught her with some substances. So yeah, once again, I can't go into details, but we're taking care of it, at least to the best of our ability.
You real. I didn't sleep very well last night because it was the 5th night in a row that I hadn't heard from you. You really need to be as good as you can, and get this rehab. Get the help that you need to get.
I'm really trying.
The better you are, the more you'll be able to call me. Talk to me about it, because I'm your boyfriend. Right? You're not trying hard enough to want to call me.
I can't. You should understand that. You were in prison for 5 years.
This guy sounds quite trusting.
Did you get to do whatever you wanted? Did you get to do whatever you wanted when you were in prison?
This new guy that you have sounds quite trusting. He sounds like he's actually there to help you. Trust this guy and do what he tells you to do. Forget the drugs.
Yeah, forgive me for asking, but this is Lorne, right? I've heard a little bit about you.
Yes.
I'll see what I can do about getting you on the list of approved callers. Keep in mind, she's still, when she calls, she still has to be under supervision, but not necessarily direct supervision. Like I said, no guarantees. I'll see what I can do. But in the meantime,
I appreciate that.
Certainly, we have to get back inside the facility here. So if there's any other questions I can ask or that you guys need answered, please let me know. I got about another minute here before we really have to get going.
Yeah.
Is there any way she can call me tonight?
Well, I need to go talk. Keep in mind I'm new to this whole thing, so I need to talk to facilitators in there, and we'll see what we can work out. Most likely, that's most likely it. I still haven't. I'm not totally up to speed on the police involvement here, but yeah, if they need to talk to her, then it's really on them. If not, no matter what, it takes a long time to get this whole paperwork thing through for an approved caller, so she'll still be monitored. Just so you know. Okay.
I love you,
okay,
Casey.
You guys have a great day.
You too. Thanks.
No problem. Bye-bye.